Hello, my name is Dr. Diwan S. Raja. Today I will discuss about locked-in syndrome. Locked-in syndrome is a neurological condition in which a person is conscious and cognitively intact but unable to move or speak due to complete paralysis of nearly all voluntary muscles except for vertical eye movement and blinking. So this person has quadriplegia. So his all four his limbs are paralyzed. And only one thing he can do, that he has vertical gaze, eye movement, blinking is possible. He understands everything, but he cannot move any one of his limbs, neither the upper limb nor the lower limb. He can't speak because complete paralysis of nearly all voluntary muscles, but he understands everything. What are the common causes of locked-in syndrome? Brainstem stroke, especially ventral pons infarction, from basilar artery occlusion. Brainstem means midbrain, pons, and medulla oblongata. What happened? Ventral pons infarction from basilar artery occlusion. Basilar artery is the artery formed by the union of two vertebral arteries at the lower part of the pons. Central pontine myelinosis, often due to rapid correction of hyponatremia. Multiple sclerosis, brainstem tumors, ALS in advanced stages. ALS means amyotrophic lateral sclerosis. In multiple sclerosis, there will be demyelination of the neurons in the central nervous system. Pathophysiology, lesions of the ventral pons affects corticospinal tracts. These are descending tract from the cerebral cortex to the spinal cord that will lead to quadriplegia. Corticobulbar tract, these are the neurons from the cerebral cortex to the cranial nerve nuclei at the brain stem mostly, and that lead to anarthia, loss of speech. Spares the reticular activating system. Reticular activating system is a network of nerve fibers and neurons present in the brain stem, extending from the cerebral cortex lower part to the upper part of the spinal cord. And it is essential for consciousness. So the person's reticular activating system is intact, so he or she is conscious. Spares midbrain oculomotor nuclei, so vertical eye movement and blinking is preserved. So midbrain oculomotor nucleus and reticular activating system is not damaged. Clinical feature: motor quadriplegia, complete limb paralysis, both upper limb and both the lower limbs. Bulbar anarthia, cannot speak, facial and swallowing paralysis. This person cannot deglutate, cannot swallow food. There will be muscles of facial expression, those will also be paralyzed. Eye movement, preserved vertical eye movement and blinking, because the oculomotor nerve nuclei escapes, damage. Sensory loss does not happen. It is usually intact. Cognition, normal. Person can understand, can realize the situation. He knows everything around him, but he cannot do anything. Consciousness is preserved. Locked-in syndrome, diagnosis, clinical suspicion, patient is aware, but unable to move or speak. If you do MRI of the brain, there's a lesion in the ventral pons. EEG normal, confirms preserved cortical function. Brainstem auditory evoked potentials, confirm intact sensory pathway. That means person can hear everything. Okay, so this is an MRI slice of bones on admission 1 and 5 of a patient. Okay, this is day 1, day 5. Day 1, it is intact. Nothing wrong here. Day 2, there is damage to the lesion to the ventral part of the pons in locked-in syndrome. Okay, initially it may not be obvious, but the day 5, there's distinct lesion on the ventral aspect of the pons of the brain stem. Okay, we got that. Now we'll look for the differential diagnosis. It may be vegetative state of coma, minimally conscious state, akinetic mutism, advanced amyotrophic lateral sclerosis, Guillain-Barré syndrome, severe form. So these are the differential diagnoses. Prognosis often poor, especially in ischemic cases. Some patients may regain partial function with intensive rehabilitation. Communication may improve with assistive technology, eye tracking, and BCI. That means brain computer implementation. Management, supportive care, respiratory support, so that patients should not develop aspiration pneumonia. Nutrition is a must. Person has difficulty in swallowing food, so nutrition should be maintained. Prevent infection. Communication aid, eye tracking devices, blinking codes, rehabilitation, physical, occupational, and speech therapy. Treat underlying cause, that is anticoagulation for stroke. Key teaching point in locked-in syndrome: body is paralyzed, but the mind is free. That is our teaching point. So, body is paralyzed, but the mind is free. Okay, so that's all about the locked-in syndrome. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.